Hello, we are just doing another manual muscle testing video. This time we are doing shoulder and scapular movements. All of these are going to be against gravity except two of them, which is going to be internal and external rotation, and those are going to be gravity lessened, just for the sake of not making her flop around. So first of all, we're going to do scapular elevation. So I'm going to have you go ahead and do kind of like a lateral tilt to your side, and then try to bring your shoulder up too while you do that motion. Awesome. And then I'm also going to have you kind of look towards your right knee. So we're also like doing like a lateral tilt and a rotation at the same time. That's the movement that we're going to be looking for. I'm going to be palpating your upper traps when you do this. So go ahead if you can combine all those motions. Good job. Okay, one more time. Thank you. And then this last time I'm going to have you do it, I'm going to be pulling on your head and your shoulder just to kind of provide resistance. It's going to feel weird because I'm pulling you apart, but don't let me break you, okay? All right, so go ahead and do that movement again. Good job. All right, the next one we're going to be doing is shoulder flexion. So with this one, I'm only going to have you, your palm's going to be down first, and then I'm going to have you just kind of go to eye level, so like 90 degrees. So go ahead and bring that down. I'm going to be palpating your anterior deltoid. All right, go ahead. Good job. One more time. Okay, and then this next time I'm going to be providing resistance at your proximal humerus. So go ahead and bring it up. Don't let me break you. Good job. And then we're kind of going to do a similar motion. We're going to do shoulder abduction. So I'm going to have you actually, your body, instead of going in front, you're going to kind of go up to the side like an airplane. Feel free to whack me in the face if you need to. All right, and then we're again only going to go to 90 degrees. So just about to shoulder height. All right, go ahead. Whoops, sorry. And then here, go back down. I'm going to be palpating for the middle deltoid. Okay, go one more time. Awesome. And then I'm going to be providing the same kind of resistance. So here at the proximal humerus, don't let me break you of this motion. Good job. And then just for sake of it, most of the support was coming from that palpation, but also supporting that humerus as well. The next one that we're going to do is internal external rotation. So this is going to be gravity lessened. So when you're doing external rotation, I'm going to be palpating your infraspinatus, which is back here in your scapula. And then when you do internal rotation, I'm actually going to be palpating a little bit lower in your lats. Just remember to keep your elbow at 90, wrist in neutral, and then I'm going to be providing some assistance and support here just to make sure that your elbow is nice and tight into your body. All right, go ahead and do external rotation first. All right, back to neutral. One more time. Awesome. And then go back in. I would not be providing resistance at this point because we are in a gravity lessened position. All right, and so go ahead. I'm going to move my hand to palpate the latissimus dorsi, and I'm going to have you do an internal rotation. Go ahead. One more time. Okay. Better, yeah. And then the last one, I'm going to do a scapular protraction. So if you can go ahead and put your head at the end of the table. This end, sorry. We apologize for the table. This is just kind of, we like to make use of what we have, just like in occupational therapy. So I'm going to go ahead and provide some, don't laugh at me. I'm going to go ahead and apply some support at the wrist. I'm not going to be helping, it's just kind of so that they don't hit themselves in the face. Kind of bringing them perpendicular to their body. And then what I'm going to actually have you do is go ahead and kind of like reach for the sky. And while she's doing that, I'm going to be palpating her serratus anterior. So go ahead, reach, good job, back down. So again, most of the support for her is actually coming from the mat or the table in this case. So I'm not actually having to really provide any kind of support, but I am going to be providing resistance because this is against gravity. So go ahead one more time. Just want to make sure I felt that muscle. Awesome. And then I'm going to be, you can go back down. And then one more time, I'm going to be providing resistance at her shoulder and proximal humerus. So go ahead. I'm going to be pushing you down. Don't let me break you. Good job. All right, and then that's about it for the shoulder. Thank you.